Hearing loss is common in people who were over age 55, particularly those people that had loud music exposure or those that worked in the factory. It's important still to protect hearing so we don't lose it. Snow blowers, lawn mowers, hunting, shooting, loud concerts all can cause hearing loss, and appropriate protection needs to be worn. Hearing loss is common and affects the whole family, and patients and families get frustrated with each other. Part of the reason is patients don't realize that they have hearing loss, and families don't often know that the patients have loss, and so arguments often ensue as people misunderstand each other. This is very different than vision. When we lose vision, we know to go to the eye doctor, but hearing is very different. When we lose our hearing, our brains tell us that everybody else is mumbling and that the background noise got too loud, and so therefore we don't necessarily think we need help. Patients then get into fights with their families, telling them all to speak up, and the families get frustrated because they have to repeat what they're saying. Patients, when they come in, are very anxious and afraid about hearing more than other disorders that we typically see patients for. They're worried that wearing a hearing aid may make them look old, and they've also heard stories about other patients who may have had bad results years ago with hearing instruments. Fortunately, since then, hearing aids have gotten much better, and patients are very satisfied when they're able to hear better. And typically, not hearing is much worse than wearing a hearing aid. And the problem comes when you don't hear, you may misunderstand people and get things wrong, or they may think that you're either uninterested or stupid. Patients with hearing loss have to undergo their grieving stages from Kubler-Ross. So they have to go through their stages of anger, denial, and acceptance, and often need help from their healthcare workers as well as their family to help get through these stages. New research has shown that patients with untreated hearing loss earn less than those people who are treated by about $14,000 a year. The other thing that's important is that untreated hearing loss patients are 6 times more likely to get dementia or confused, and 4 times more likely to get depression, particularly as they age. The reason why you wear hearing aids is not only to help prevent the health disorders of dementia and depression, but also, more importantly, to keep you connected to your friends and family. Your family loves you and wants to have you be part of their lives, and hearing them appropriately will help this happen.